So when you're looking at this, we've looked at technique. How was this picture developed? We already looked at that. And now we're going to look at, we looked at lines and tubes. We did that, right? Now we're going to look at bony structures, anatomical structures. So if we look at our ribs here, do you see anything wrong with these ribs?
Not those. The other ones.
How about these? You see these?
Yeah.
So you have major fractures here. I see 1 fracture, 2 fractures, 3, 4. Do you have a flail on this chest?
Yes. Yes.
How many say yes?
Yes.
Raise your hand if you think there's a flail. 1, 2, 3. You guys think there's no flail? No flail, no flail? No flail, Eileen? That's right. What's the definition of a flail?
2 or more.
2 or more with 2 adjacent. So I only see 1 fracture here. So there's not 2 in the same rib. So this would not be a flail. Okay.
Oh, that's not a fracture up there. The third.
This
fourth,
one's a fracture.
And then down. No, that
this
same
one's a
one.
fracture.
That same rib on that first
This
one.
one here?
Yeah. If you go follow it right there. Is that a fact? I mean, from here. I mean, I don't know. I'm not a.
That looks like there could be something right there, but there's not 2 in this one. You have to have
okay.
2 parallel. Okay.
Mm-hmm.
So I don't see a flail here, but looks like it hurts pretty bad, right? So sometimes with X-rays, it's hard to see rib fractures. So if they suspect rib fractures, because maybe you had blunt chest trauma from a car accident, a motorcycle accident, they could do a rib series. And the rib series is going to show the frontal, the anterior, and the posterior, and they're going to kind of put those 3 together, and they can see the entire rib size, and they can look for fractures there. Okay. So look at this. So this X-ray here, you see all this kind of haziness here, right? Doesn't look normal, does it? This is escaped air into the soft tissue. It's dissected through the tissue planes. Looks like this patient has blebs or bullous emphysema, which are non-functioning alveoli that kind of blow up, right? They don't function anymore. They're distorted. They don't have pulmonary vasculature around them. And when they pop, they can cause an air leak into the pleural space. So you have a pneumothorax here. You see this line, okay? This is the visceral pleura right here, and all this is free air. There's no pulmonary vasculature there. All this air has escaped into the soft tissue, okay? And all this here is air. So if you were to feel and palpate this patient, what would you feel? Crepitus. So this patient has an air leak, right? This patient probably needs a chest tube, okay? Yes, question.
How can you tell that this is not an overexposed?
Well, it definitely looks overexposed, but this is just showing you, this is just a picture that we got. So it does look overexposed, but it still shows you that there is a pneumothorax and there is an air leak. Air is leaked into the soft tissues, okay? So, pleural space. So we said air can leak out into the pleural space, causing pneumothorax.